Hi, Lisa. Thank you so much. So, I'm so excited about this webinar. I'm a general dentist and I love doing operative work. And so, I just want you guys to relax, listen to what I'm saying, make sure it makes sense in your mind. And if you have any questions, as Lisa said, chat box is fine. But also at the end, I'm going to give you my email address so you can always email me questions. If you want this whole presentation, I'll send it to you. There's other ways you can get it if you missed anything, but I just want to get started, get going, and let's tackle these class 2 restorations. I'm going to start and take these steps, starting from cavity prep all the way up to contouring, fishing, and polishing these types of restorations. The demonstration tooth that I'm going to be working on for the most of this presentation is going to be tooth number 31, and the surface is going to be MO. I really take pride in doing class 2 restorations. I have a lot of fun with them. They're not a struggle for me. Now, years ago they were, but now we have a lot of new technology, whether it be materials, whether it be equipment, to kind of tackle these and make them a lot easier. So I like them. As we go through these steps, I'm going to share some tips, some problem areas, and some solutions to those problems that come about when we're doing class 2 restorations. So let's get started. I'm going to break down my cavity prep design into two groups. One, the internal design, and the second, the external design. This internal design, I'm trying to get rid of all the decay, all the caries. Number two, I'm trying to make everything nice and smooth and round. So all my line angles are nice and round. As you can see in this tooth here on the lingual, nice round areas going on the occlusal. I want everything to be round. I don't want any squared or tight 90-degree angled shapes in my cavity preps. Also, I'm creating the box. This is probably about 2 to 3 millimeter deep box. It's not too big. This is kind of a medium to small size type of restoration that we're going to be creating on this particular tooth. Also, I want to make sure that on this axial wall, I want this area on the very top of or the edge of this axial wall to be nice and rounded or beveled, anything, but I just don't want it to be a 90-degree angle from the axial wall to the floor of my occlusal cavity prep. So again, beveling or rounding off this axial wall edge. I want everything nice and smooth in my cavity prep internally to allow the material to just kind of flow into the type of shape that I want this restoration to be. To do this, I'm using this burr. This is a pear-shaped burr. Some of the features of a pear-shaped burr is that it has a nice rounded into it, like a round size 4 or 6 type burr, diamond burr. And then it has this long kind of just an area that allows you to prep the walls in a way that makes it nice and easier as opposed to just using a round burr. This is a new burr from Premier. It's called a Priva Diamond burrs. They're high performing, low cost burrs, and they are excellent. This demonstration, I'll be using several of their burrs. All of their Priva burrs have smart edge technology, and what that is Premier has been able to position the diamonds on these burrs so that they maximize the amount of diamond to tooth contact. And so they cut fast and accurate. And the thing that I like about them, even though they're diamonds, they leave a nice smooth surface to the preps that I do. Next is the external design. In my external design, I want to make sure my occlusal margins are beveled, and I'm going to well define my gingival margins of this cavity prep. As you can see, same burr, same pear-shaped burr, and I'm just going to run this burr across my occlusal table or occlusal part of the prep and bevel it out. Again, no 90-degree angles at the top of this cavity prep. I want to make sure that it's nice and slightly beveled. And I can do this with this burr. I do one side, as you can see, on the lingual, and then I'm just going to flip the head of this handpiece and do the buccal side to get a nice beveled area around this entire occlusal surface. Once I'm done with that and my box looks okay, this is the opportunity to take and step back and take a look at the adjacent surface that I'm going to be creating contact with this restoration. I want to make sure that this distal portion of tooth number 30 is nice and smooth. It's either straight or slightly curved, as you can see. I want to make sure there's no decay. If there is decay, now I have access to that decay, remove decay, fix it, and then make sure that, again, that it's nice and smooth and have a good area to contact with my restoration. The other thing is I have access to see my gingival margin of that box. And it's very important because I want to make sure that if there's any adjustments that I need to make, now's the time for me to make them. Not when I'm struggling with the matrix and wedge. I want to make those calls early as possible if I have to. Again, the burr that I'm going to be using this is a Priva diamond burr. This is a flame shaped burr. And what I use it for is making sure that that gingival margin, as you can see in the circle, is either straight or convex. I don't want it to be dipped in or concave. I want my margin to be this way because this is going to allow for the best way that I can seal off this margin with my matrix and wedge. A lot of times, and this is where class 2 restorations get kind of tricky and cause a lot of frustration, and that's at the gingival margin. And if you have a gingival margin that looks like this to the left in this circle, automatically you have to be thinking, this is not good. I need to make some adjustments to allow this to be either straight or slightly curved. This is not going to work. And the time to recognize it is now, before you get to here, where you're trying to fit the matrix in place, add the wedge, and trying to make it work. So back up before you get to this point and make sure you address it in the very beginning so you're not frustrated and wasting time trying to make this work. Because I've been there a lot of times where I'm ignoring the signs. This is not straight. I'm going to go ahead, shove that matrix in there, trying to make it happen with the wedge. I may close the space a little bit, but it's not all the way closed. And then what do we do? Now we're thinking. And when we're thinking, we're stopping. Okay, what should I do? Should I take it all apart and start all over again and make my adjustments? Or should I hope and pray that whatever bonding agent I'm going to be using is going to seal off that small little gap and allow me to finish this restoration? Most times we waste by just taking it all apart and then starting all over again. So doing this from the start, you want to make sure that you correct this area to the left here. Again, with this burr, I'm able to make that area slightly curved or straight. This burr does a good job in making that work. Then I can go ahead, paste my matrix and my wedge and making sure that I have a nice tight seal at the gingival margin. Again, nice and straight. Good seal at my gingival margin with my matrix and wedge in place. Now, as far as the matrix systems, there are lots of them out there. You got the traditional old school band and Toffenmeyer retainer. Now there's an updated version of that with the disposable band. There's also many sectional matrix systems out there. You see there's Garrison here. You got the Dentsply uh, version of their sectional matrix, and then you have Premiere. Now, in this demonstration, I'm going to be using the 5X sectional matrix system by Premiere. And the thing I like about this system is that, one, it has components, especially the ring, that you can use with other systems. So their ring goes with other sectional matrices, other wedges. Number two, their ring is just one size. A lot of systems have multiple size rings. Then you got to pick and choose. Do I need a small one? Do I need a big one? This system only has one size. The other thing about this ring is that it's disposable. So after maybe 5 or 6 uses, you can throw it away. However, you can still use it longer than that. So that I appreciate because these rings are very costly, and it just seems like the other systems you only get like 1 or 2 of these rings. When in this system you get 5 rings to start, and then you can add to them once you go through them. But the rings are plenty, and more importantly, they're low cost. I think right now they're probably like about $8, so that makes it very, very inexpensive and allows us to keep more rings around when we need them. Also, they create separation just like the metal rings. Now, one thing is about matrix systems is that there's not one matrix system for just all situations. Sometimes, even though I like the sectional matrix, sometimes the cavity prep is too big, and I'm going to have to use a regular um, matrix band and retainer as opposed to using a sectional matrix band system. And so you have to keep that in mind. This is the one that I typically use routinely. And if I can't use this, then I'm switching out to a regular matrix band and wedge. And as I mentioned before, the other good thing about this system is that the ring itself can be used with other parts, other wedges and other sectional matrices. So this is another kind of area that people get frustrated in terms of placing whatever matrix they're going to be using, and now we're going to be concentrating on a sectional matrix. A lot of times, doctors will, the next step, place the matrix in place, and then try to wedge that wedge into place so that it seals the margin of your box. So what that does is it causes frustration because it doesn't always work that way. Your wedge doesn't always easily just slides in place and seals off your gingival margin of your box. So what I tend to do is I like to do this kind of backwards. Before I put my matrix in place, I like to try in my wedge. And what this does is it allows me to A, kind of see a little bit better because at this point the matrix isn't there. All I have is my open contact with between my teeth and the wedge. And so now that I can see like the path on which that wedge is going, I can see if the wedge is going to do the job in terms of being very close to and able to seal off my matrix at that gingival margin. And more importantly, I can kind of get an idea of, okay, what's the best way to put this wedge in? Is it going coming from the buckle? Or is it going to be coming from the lingual? All that is possible because I'm just trying to wedge in, as opposed to putting that matrix in and just trying to find my way through and find the best way that wedge is going to fit. Also, when you do it this way, trying in the wedge, you get a sense of where or if that wedge is going to impede you creating a good contact. Typically, when you have a large space and you're doing a class 2 restoration, it requires a larger wedge. But the drawback of that, having a larger wedge, is they're usually a little bit too tall. And sometimes they can impede how or where you're going to be putting your contact. So the beauty of using these types of wedges, you can trim them back so they're not so tall, and you have still have access to create a good contact with the adjacent tooth. So again, trying the wedge in saves a lot of headache before placing the matrix and putting it in place. Now, I prefer the wood matrices. I prefer the wooden wedges, but a lot of times doctors like the plastic wedges. And the problem that I have with the plastic wedges is that they have this little curve in them. Most of them have this little curve in them. And that's not very good in terms of sealing off my gingival margin to the matrix that I'm going to be using. And so as you can see here, there's a curve in this green wedge. And as you slip it through, sometimes you still have some space, you still have some gaps in between the wedge and that gingival margin. So I'd rather not have that at all. And I think I do a better job of sealing that off with a regular wooden wedge. So that's what I'm going to be using throughout the rest of this demonstration. This is, I've already tried in the wedge. I've put in my matrix and now the wedge is in place. Everything is nice and sealed off here. And then I'm going to put my ring in place. So that's a good start. This is the lingual, nice and sealed to the left here. And then this is the buckle, nice and sealed. My matrix is doing a good job and it's in place. Now, this ring is not only keeping my matrix very sealed or close to my cavity prep, but it's also holding down the wedge and making sure that it's staying in position. Now, sometimes after we've placed the wedge in between the teeth and we have our matrix pretty much set into place, that ring can cause some bulging at the gingival margin, as you can see here. And one of the ways some doctors like to fix this is by either using Teflon tape, or in this case, you see here is a cotton pellet. By using these materials, we can kind of place them in approximately, as you can see here with this cotton pellet, to kind of seal up that portion of the box and the matrix. Tucking this cotton pellet down into towards the gingival margin more. And here you can see the cotton pellet is tucked all the way down, and it creates a nice seal at the gingival margin. Now, whether it happens on one side or the other, you can do it on both if that's what's happening with your matrix band, to kind of slow down having to go back and reposition your matrix altogether. Now that we have that taken care of, the tooth has been, the wedge has been placed, the matrix is also in place, everything is nice and sealed up, and now we're coming to the portion where we're going to condition the teeth. And we do this by etching, desensitizing, and use of a bonding agent. So most studies have shown that with class 2 restoration, the biggest reason why they fail is what? Micro leakage. For the most part, that is the biggest reason that these types of restorations fail. And whether it's you don't have a good seal at the gingival margin, or you're not following proper bonding techniques, that is the biggest reason why these restorations fail. And so in this particular study, they studied the techniques of etching. And they took all three of the techniques, whether it's self-etch within your bonding agent, total etch, or selective etch. The best way that prevents and controls micro leakage is the self-etch method. I'm sorry, the selective etch method. So I try to stick to that method, not just with class 2 restorations, but any type of restoration. I'm doing a composite and we're bonding, I want to do a selective etching of the enamel, because that's going to give me the best chance to decreasing the amount of micro leakage over a period of time. And then the method that did the least amount or caused the most micro leakage is the self-etch, using the self-etch abilities of your bonding agent. So that's not something that you want to rely on for your restorations. You want to do some type of etching, and selective etch is clinically or proven to be the best method to use. So we're going to select the selective etch around my cavity prep, as you can see here to the right. And the other thing that will help you save time is that making sure that before we use our etch, we want to express it out so that that tip is filled and ready to go. And so while I'm, placing my matrix and making sure the ring is in place, the next step is going to be to use this etch. As I'm doing that, either I have my assistant kind of, as you can see to the left, take that etch tip, start expressing material out, because I don't want to waste time getting it and having to do that and then not knowing how this material is going to come out, whether it's going to splat everywhere or is it going to come out a little bit. I just want to make sure before it gets into my hand. So again, trying to cut down and minimize time, I want to make sure that it's already kind of flowing out of the tip that I'm going to be using. After we etch, I'm rinsing it. And the next step is desensitizing and disinfecting. Now, there are many brands on there. These are some of the more popular ones. The Gluma, which everybody has heard of, desensitizing your cavity prep before you're placing your bonding agent. There's also Clinician's Choice G5, which pretty much does the same thing in terms of desensitizing and also disinfecting your cavity prep. But I like to use Hemosil. Hemosil is by Vantage Dental Products. It does a good job not only desensitizing, but more importantly, as my antimicrobial effect, because it has chlorhexidine in it. And so that does a lot in terms of, again, trying to minimize the micro leakage over periods of time. It also enhances the bonding strength of whatever bonding agent you're going to be using. It's a clear liquid, as you can see in the lower right here. I'm using a micro brush. I just dip it in here, scrub that solution into my cavity prep for about 10 seconds, and then air dry for another 5 seconds. And then that's it. There's no light curing. It's a good product. There's no smell. It's not a strong odor to it. It's just a clear, simple product that does a lot for long term for your restorations. Again, Hemasil. So now I'm going to go over some techniques that I use in basically for small to medium sized restorations. I'm going to be using a combination of universal composites and a flowable composite. And typically I'm going to be incrementally layering these materials into place for this type of restoration. Also, I'm going to go over techniques for a larger and deep pocket restorations. In those situations, I want to use a bulk fill material, and I'll go over those right now. So for small to medium-sized class 2 restorations, I'm using a composite and a flowable. Now, a lot of times, docs will have a composite that they like, but not like that same manufacturer's flowable. So they'll use another flowable system with that same composite, or vice versa. They have a flowable that they like, but the composite isn't so great. And so I found that these two companies, Shofu and Kenback, have very good combinations of composite and flowable. They work very well together. They're very consistent, and more importantly, especially with the flowable, there's no bubbles in this material when you're using them. So with the Shofu, the Beauty Fill 2, and the Beauty Fill Flow Plus, those are very good composite flowable combination that works very well. The other by Kenbach, the Versalis Fill and Flow, again, two materials that work very well together. They both have good shadings that complement each other. And for the most part, the only difference between the Shofu and the Kenbach product that I feel that's makes a big difference is that Shofu's ability to have a bonding agent with their restorative materials. So not only are you getting the composite and the flowable that work together, you're also getting a bond that also goes with that particular product from that same manufacturer. So I try to kind of make sure that I keep that all together when I'm doing these types of restorations, because long term, the research is done in terms of, okay, when you're mixing and matching with different materials with different manufacturers, it's not as good as when you're sticking with the same manufacturer's materials. So that's what that I'm trying to do here. So the composite and the flowable are going to be Shofu products, Beauty Fill 2 and the Beauty Fill Flow Plus. Now, both of these products are bioactive. They have Gymer technology, which gives both of these products the ability to release and recharge fluoride and other ions to make their activities more compatible for the tooth. It makes the tooth stronger, has antibacterial components to allow the materials not to have a lot of buildup of bacteria on them, and they also neutralize acids around them. So these are good bioactive products that work very well together, and that's why I'm using them. The bonding agent is Beauty Bond, also from Shofu. It's a seventh generation bonding agent. Its dual adhesive monomers allow it to have equal strength to dentin and enamel. It's very thin, and it comes in a bottle in a unidose vial. Now, with the small size to medium sized restorations, the technique that I'm using, now we've already disinfected and desensitized the tooth here to the left. Now I'm going to apply my Beauty Bond bonding agent, 10 seconds, air dry for a couple, like 5 seconds. The next step is a little bit different. I want to take a plastic instrument or a football burnisher. I want to make sure that I put a little pressure on this matrix band to create some contact with this adjacent tooth. Notice that I'm not down on my margin here. I want to be up where I want the contact to be and put a little pressure. But that pressure can't be so great that I'm creating some space. So again, bonding agent here, I'm creating pressure against the adjacent tooth, and then at the same time, I'm lighting that. Now, you don't see the instrument here because I only have two hands. So I'm holding curing light in one, I got a camera in the other. So typically I would have that instrument here in place. So you get what I'm saying. I want to make sure that I'm not just throwing some bonding agent in here and light curing it. I want to make sure that I'm creating positive pressure against the adjacent tooth to create my contact. Once I do that, I'm going to use the flowable to frame my box. So the, the flowable material that I want to use, I'm going to flow that here onto the buccal interproximal wall, down to the gingival margin, and then back onto the lingual interproximal wall. As I do that, I'm going to, again, apply not as much pressure as I did before because I don't want to break the seal of my bonding agent to my gingival margin, but I'm just going to apply just a little bit of pressure because remember, this is flowable material. It's not going to press against that adjacent tooth or this matrix. So I want to give a little bit of pressure there. And then as I place this material, I'm going to light cure it. Again, same thing with the flowable. I want to make sure that this flowable tip is ready to go when I use it. So as I'm creating, before I'm using it, I want to make sure that I express some of them out of the tip just a little bit so that when I get it in my hands, I'm going to just go in and start framing my box, as you can see here to the lower left. Now, I'll continue to layer this restoration in this box with the flowable material. I'll probably put maybe 2 layers of flowable, and each time I place the flowable, I light cure it. Each time I place more flowable, I'll light cure it. So I get to a point where I'm about 2 millimeters left, and then I like to, no matter what type of flowable I'm using, even though flowable nowadays can withstand occlusal surfaces or occlusal forces, I like to top it off with a regular composite. In this case, I'm going to be using the Shofu composite to place on top of it. So the technique is this last layer of flowable that I'm putting onto this restoration, I'm not light curing it. I'll just place it, and then this is unlight cured flowable. I'm going to put my regular composite on top of it and then use a plastic instrument of some sort or a ball burnisher to kind of make sure that everything is nice and covered and put into place. So I have a nice clean juncture between the flowable that I'm using and my composite. When I do this, there's usually no bubbles, no voids, and it comes out really, really nice. In the next few slides, you'll be able to see what I'm talking about. But once this is done and I have it in place here to the right, I'm gonna light cure this. Now, for larger restorations that have deep boxes, I'm going to use a different material. I'm not going to use a composite and flowable. Instead, I'm going to use this bulk fill material called Bioactive Bulk Fill by Pulpdent. Now, this material is dual curing, which means that whether I cure it or not, it's going to cure. So it's unlimited depth of cure. So no matter how deep the restoration is or how deep your box is, it will get cured. Also, it has low shrinkage stress. It also is bioactive, so it releases and recharges calcium, fluoride, and phosphates. All these things help naturally remineralize your tooth to decrease the amount of micro leakage. So same technique. I'm going to use my bonding agent. I'm going to apply some pressure before I light cure it. And then I'm going to use this bulk fill material. In the same way that I use the flowable, I'm going to frame this up. Now, because it does self-cure, you still have time. And so when I frame this up, I want to make sure that everything is covered so I don't go back after I light cure this. So framing it up, light cure, and then after that first light curing of this particular amount of material, then I'm gonna fill the rest of the restoration up to about 2 millimeters. Again, I can't fill it all the way up, but in this case, I feel more comfortable, even though it's a bulk fill, and even though that we can just use this as the occlusal surface, I like to top it off with regular composite. The good thing about this particular material, I'm not sure how they do it, but it not only stays where you put it, but it also has a self-leveling component, meaning that even though I've placed it here on the gingival margins in the gingival box, I place it on the side, and as I place it on the side, it's able to get into the corners and making sure that there's no voids, there's no spaces with this material, whether it be on the lingual here and on the buckle. So I really like that about this material, that it stays in place, but then it also has the ability to move and seep into those areas where you want a flowable to seep into it. The other thing about this material, or actually not about this material, but about the delivery system, has a long bendable metal tip. And as you can see, I've bent it slightly. So if you're dealing with an upper tooth, a DO, access to that is easy with this particular type of tip with this material. Again, once I filled up and I'm about 2 millimeters short, I'm going to cap this off with the Beauty Fill composite. So typically, once that's done, and this is the beauty fill and the bulk fill material, I typically don't use a piece of floss to check my contact. This is all the checking I need. Once I've removed the ring and removed the wedge, when I try to remove the matrix, I usually take this cotton plier, and it takes a little bit to kind of take this out. So that's confirmation for me that, okay, I've done a good job. I've got really good contact. And if you do the technique as I showed you, you always will have good contact. It's not even a question. It's like, okay, sometimes I have too much, but I'd rather have a lot of contact than no contact at all. Once I remove this matrix, this is what it looks like. This is before I do any kind of contouring or reshaping. So I have really good contact, no voids, everything is nice and covered, no bubbles. Now this is the second burr. I'm still in the second burr. I'm going to take that same flame burr that we used to define our gingival margin, and now I'm going to take that burr and just do some contouring around the interproximal margins of this restoration. Again, I have access not only on the buckle, but also on the lingual here to make those adjustments and to make this nice and smooth. As you can see, this is my buckle margin. It looks perfect. And for the most part, every time I use this bulk fill material, these are the types of margins that I'm getting. Nice, smooth, no voids. Everything looks nice and good in terms of this restoration, in terms of how it's been filled. This is the lingual to the right. Again, nice, smooth fill, no bubbles. As you can see, I have access to this. And the burr that I was just showing you, the flame shape burr, does a good job of just contouring and smoothing this area out. Same thing on the buckle here. I have access to this, and that burr allows me to kind of make this area nice and smooth. Once I've done that, I'm going to switch to my last burr, and this is a finishing burr, a gold 12 fluted egg-shaped finishing burr. This is a 7408 burr. Um, the thing that I like about it is I'm able to do a lot with it in terms of not only finishing those restorations, but also it polishes up very nicely any type of material that I'm using. and I want to adjust the occlusion, this is the burr that I'm going to be using. The unique thing about this burr, it has not only a nice round tip to make or create any kind of grooves in the restoration, but it also has a nice flat part of it or portion of it that allows me to make sure that there's a nice smooth um, surface between the tooth and the material. And so with this burr, I've adjusted my occlusion with it. And as you can see, it looks nice and smooth. Um, Basically, it looks like I've polished this with this one burr. And it does a good job of doing that and making things look nice and smooth and feeling nice and smooth to the patients. And as you can see here, we've created nice, long, broad contact. This is not a point contact where you have one area that's touching your adjacent tooth. I got this is a good 2 to 3 millimeters of material that's touching the adjacent tooth. So that's good, strong contact. As you can see here, the margins are nice and smooth on the buccal, the same thing on the lingual. The materials that we're using does a good job in terms of allowing us to make strong restorations that are bubble free, void free, to allow them to extend their life and have less micro leakage. And that's the whole goal of trying to fabricate these restorations in a way that they're going to last a long time. And the way to do that is trying to control the amount of micro leakage with your restorations. Now, these last keys are also in hopes of trying to quicken your pace and trying to allow you to be a little bit faster with these types of restoration. One is you don't want to stop. Once I start the cavity prep in the very beginning with that first burr, I don't want to stop until the very end where I'm using my last burr and I'm cleaning up and checking the occlusion. And so between that first burr and the second, I'm only changing burrs 2 times. I'm only using those 3 burrs. Again, that's making me more efficient and more using less time to get through the actual procedure. Also, you want to be prepared. You want to make sure that not only you just have one wedge, you want to maybe have 2 different wedges there, just in case one falls or breaks, so you're not stopping. Same thing with the matrices. You don't want to just have one sectional matrix there. You want to have maybe 1 or 2 there in case one gets damaged or lost. So you're not stopping. You're prepared and you're keeping going. You keep going through the procedure. And then the last thing is you want to develop a technique that fits you so that and stick to it, because the more you do them, the more efficient you become, and it's easier, and you start to enjoy doing these restorations a little bit more. These are the final photos. This is the buccal aspect of this tooth number 31 MO. Nice clean margins on approximately, and this is the occlusal surface of that same restoration. Thank you guys for listening. This is my email. And are there any questions, Lisa, from the chat?
And yes, we do have a couple in there right now. Um, all right, you said the ring holds the matrix in place and also seals the gingival margin. Does the ring you are using also create some tooth separation to help ensure contact and counteract any polymerization shrinkage of the composite?
Yes, it does. Most of the sectional matrices comes with rings that do that. They do create some separation. However, along with that separation, I like to, as I showed in the technique, take my instrument and making sure that I have good positive pressure against that adjacent tooth with that matrix. So yes, you're getting it with the ring, but then I also create a little bit more with my instrument in curing the not only the bonding material but also the restorative material that I'm using at that part of the procedure. And usually it's the flowable material that I'm going to be like curing into place as I frame the box of the restoration.
Yeah, how do you round the marginal ridge? It looked like occlusal um, excess was present, and I often have that as well.
Oh, so once I removed the matrix, as you can see, some of the material was higher than the adjacent tooth smaller ridge. So I use that gold egg-shaped burr. As I mentioned, not only does it have a round tip to it, but it also has a nice flat edge to it as well. So I'll use that flat edge to kind of bring that down. The good thing about that burr is because it is a finishing burr, it's not going to cut the enamel. So it's a light touch, and I can set that burr on the adjacent tooth and allow it to cut the material to the exact height of that adjacent teeth. So I'm using that egg-shaped gold burr in the flat surface of that burr. And as you can angle it as you can angle it to not only reduce the height of that marginal ridge, but also you can create a little groove in it with the round tipped area to it.
Okay. What kind of composite could be used as core if we don't want to crown a tooth, and also the outer layer, what kind of composite?
What was the first part? What kind of positive for the core to do
Yes.
what?
What kind of composite could be used as core if we don't want to crown the tooth?
Oh, if you don't want to crown the tooth. And well, in this case, or in that case, that would be like a build-up material. So again, the bulk fill material is great because it's dual curing. You're never worrying about how big or how deep a restoration is, and you're trying to cure it because it has self-curing properties to allow it to have unlimited depths of cure. So that's a good material to use, whether it's a class two or whether it's a build-up, or it's a big build-up. That's my go-to material to use.
Someone is asking, which matrix system do you recommend?
The one that I had been talking about by Premier, it's the X5 sectional matrix system. And the advantage of that system is the ring. The ring is very inexpensive and it can be used multiple times. And it does the job as any other metal ring can do in terms of not only keeping the wedge in place, but also creating separation.
And someone had a comment that they teach their students after removing the wedge and band to further light polymerize the interproximal surface from both the buccal and lingual surfaces for 20 additional seconds per side.
And so because I like to frame my my cavity preps with a flowable material, those areas are going to be sealed up and light cured fully, without additional light curing once I'm taking off the matrix. So basically, because I'm placing this material in layers, every layer gets light cured to the fullest. So in this case, all these materials, the light curing time is going to be a 10-second cure. And so as I put my first layer down of flowable and I'm framing my box, I'm going to light that for 10 seconds. And so that allows me not to have to go back and light cure both buccal and lingual in the interproximal area because that material is going to be already light cured and already cured. Also, in the sense of using the bulk filled material, same thing. It's flowable enough and I'm using it to frame my cavity prep, but I'm light curing it at that point. Again, at that point, it doesn't need additional light curing, especially because it also has self-curing properties that are going to also kick in if I've missed or not cured anything enough.
Do you use Soflex type discs to develop a rounded marginal ridge?
I don't, but you can do that. Again, I'm trying to be efficient and trying to make sure that I create a restoration that is not only long lasting but functional. In this case, I like to just make sure that my my marginal ridges are equal to the adjacent teeth, and then checking the occlusion to make sure that they're not in occlusion in terms of when the opposing arch and the teeth come together. I don't want my restoration to be in occlusion in that area. So I'm not really too concerned about rounding that off and making it more like a traditional tooth. I'm more concerned about making sure that I have nice tight contacts and then making sure that the integrity of the material that I'm using is nice and solid so that it can withstand those occlusal surface forces over time. Now, I showed one of the in one of those slides I showed you me taking out the matrix that is in between the tooth and the adjacent tooth. And so what that also tells me is that even though I'm not flossing at that time, that patients will be able to get floss in between there. So even though it's a tight contact, it's a flossable contact.
Okay. Um, do you use a glass ionomer like Vitrabond to protect the dentin, or do you use selective etch to avoid placing the etch on the dentin?
So basically, I try to make sure, as I showed you in the slide, that whenever I'm using any type of edge, I want to make sure that I'm expressing that edge out first on the side so that the tip is filled and ready to go. Because what I don't want is I don't want a lot of edge onto the dentin. And especially in the box area, you don't need a whole bunch of etch in that area because there's not that much enamel in that area. So a small, thin, line of etching in that box, deepest box area on my marginal ridge is, I mean, on my gingival margin is all I kind of use in that area. And then I'll just bring it up to the sides and all around the occlusal surface. So
Can you,
the other part of that question was that do I use a Fisher bond or as a base on the dentin? I don't use Vitcher Bond, but I do use Limelight, which is a good liner to use. It's light curable, and you can use that to cover any exposed dentin that you have questions about in terms of causing sensitivity with.
okay, can you go into more detail on making the gingival floor straight or convex after you detect that it's concave?
So one of the things that I try to do is making sure that I'm doing things in an order that makes sense. And so once I've prepped my tooth and created that box, and I've beveled my occlusal surface, I step back and look specifically at that marginal gingival margin. And I want to make sure that I take that flame shaped burr and just run it across it. And sometimes, even though it may already be straight, I just want to make sure that it is. So I define that by just going along the side of that and making sure that it's nice and straight. It's not chippy. I don't have, unstable enamel on that area. I want to make sure that it's nice and solid. And so that's how I make that nice and either straight or slightly curved by using that burr. And you have the space to do that because you don't have you've broken the contact. You can see that there's no tooth structure in there. And so I just want to make sure that I just run that burr back and forth, buccally and lingually, until it's nice and straight or semi-curved.
How often should you replace the rings?
So the trick with the rings are they say you should use it only 5 times. So to kind of know how many times we've used it, every time we use it, we put a little notch. I'll use, I don't know, whatever bird that I have there, any diamond bird will do. I'll put a little notch on that ring so that I can see, okay, I've used it 1 time, 2 times. So when I get 5 notches on the ring, then I say, okay, we're going to use it, but I'm going to have another one for backup. So you always, again, be prepared because after time, they start not staying in place. And so if you've gotten one and you've used it more than 6 or 7 times, then you might want to consider, okay, this one may be done. And that's a way to keep track of how many times you've used the ring and when to replace it.
What bonding agent do you use with the dual cure composite?
The same one, the Beauty Bond. I use the Beauty Bond with the Shofu Composite, and then I use the Beauty Bond with that dual curing bulk fill material. So again, I'm just trying to be efficient. I don't want to have, okay, I use this bonding system with this product and another bonding system. I just want to use one universal bonding system, and this bond is pretty good. It's universal. It goes with all materials. this is an area where I'm stepping away from, okay, using the same manufacturer's composite with their bonding. I try to do that with the show foods composite and flowable. It just so happens that the bulk fill material that I really like is this by Pulp Dent, and I don't use their bonding with this.
How do you prevent getting the white line on your occlusal aspect of the restoration?
So one, I'm gonna use this gold shape finishing burr. That does a lot in terms of making sure that that margin is nice and clean and there's no ledging in it, because sometimes when the margin isn't clean and flush, it creates that white line. The other thing that I do, and that I do not just for the class twos, but for most of my restorations, when I'm done and I've checked the occlusion and everything is ready to go, the last thing I do is put a layer of bonding agent over those margins, over the whole restoration. And in this case, sometimes it's tough to do with a class two restoration because it sometimes involves the soft tissue. So if it's not messy, there's not a lot of bleeding, and everything goes right at the end, what I'll do is I will take one of the sectional matrices and maybe put it through just the top portion between those two teeth where the contact is, and then I'll cover that whole restoration with bonding agent and then dry it off really well, and then like cure that. What that does is that seals up all of my margins, and it will get rid of any kind of white lines that may appear because the resin is filling in, and then I'm light curing that. So two ways: using that gold egg shaped finishing burr and then sealing it with bonding agent.
Okay, we have several more questions, so I'm probably just going to take a select few.
Okay.
Um,
And then they have my email address. So any
Correct.
questions that I don't answer, feel free to email me. I That's not a problem.
Do you ever use a 12 blade to remove excess flesh?
Um, the excess flash that I have, if it's on the occlusal, I'll use the burr that I showed you, the gold shaped, egg shaped burr. If there's flash on the side, I'll use the flame shape, or that it could be either the one that I showed you in the demonstration was a fine or a red labeled burr, but you can also use an extra fine, which is the yellow. That also does a good job of removing the flash and helping you contour those interproximal areas on the side, buccally and lingually.
What is the advantage of rounded line angles in the preparation?
So with the rounded angles and rounded areas, it allows the material just to flow a little bit better. It definitely helps in terms of cutting down on any kind of voids or pits at the margins, as you can see in those last slides where I'm showing you interproximal areas where I've framed with the flowable composite. It's nice and smooth, and so there's no bubbles, no voids. It's just pure material there. And so that's what I like to see. I basically just trying to make sure that if things are nice and rounded, then that material is going to flow and be able to get into the areas that I want it to be into, and also decrease the amount of voids possible with that restoration.
When you straighten the concave floor of your box prep, do you have to remove more of the buccal and lingual walls, creating more buccal and lingual clearance? Because otherwise the box will still be concave as a whole.
Correct. And sometimes that does happen. I try to make sure, and it just depends. If there's a big dip in between buccally or lingually involving that that gingival margin, then yes, you will have to take off more of the tooth structure. But I gain that back in the sense that now it's going to allow me to get good contact, but more importantly, it's going to be able to expose those margins. And that exposure allows me to make sure that things are going good with that. When patients come back, and since those margins are going to be visible. If there's anything going on, whether there's decay that's starting there or if something is open, I'm able to fix it without having to do the whole restoration over again. So the disadvantage is I'm taking off more tooth structure, but the advantage is I'm putting in material that I'm able to monitor and make sure that it's going to be there over a period of time without having to redo it or replace the whole restoration in terms of secondary decay.
Okay, last final two questions. What is the key to getting your marginal ridge perfectly rounded like that? I try using an explorer to round out, but that does not always work well.
So the bird that I showed you, that flame-shaped bird, works well. Anything that's like sharp or needle sharp will do the trick. I'm able to start from not from the top, but from the bottom and approximately, and then come and work my way upwards. So it's not going down to make it round, it's coming up into that space without taking away any of the material that's going to disrupt any type of contact that I have. So if you can imagine just again that pointy burr going in approximately but below the contact area and then just coming up and just kind of reshaping that.
Okay, so final question is, how do you restore efficiently when you have a bunch of large MODs in one quadrant? Do you use a top mile or a different system?
So the beauty of this system, the Premier X5, is that it comes with multiple rings. So if you have multiple restorations to do, it can be done that way. I've done that. The only thing that I don't recommend is that when you have two restorations that are side by side, you're doing a DO and an MO. I try to not do them simultaneously, meaning having the two matrices there and filling that up and then, hoping and praying that I'm going to get contact somewhere. I typically will do one of them, I'll use a regular band, usually a disposable or a Tough band, a regular band for one of them, because that's quick and easy. I can just put that band on. I'm not worried about separation. I'm not worried about making contact. I'm just worried about restoring that proximal wall so that I take that off. I got a nice solid wall there. And then I go back and use a sectional matrix on the second or adjacent tooth. So that way, again, I can create good contact, positive contact. It's a little bit time consuming, but I get that time back in terms of I have a restoration that's going to stay there for a long time. I'm not going to have to redo it. I'm not going to have to be worried about the contact and having to add more material at the end and trying to get the contact that I'm hoping for. I'll get it as I do it.